Good afternoon, everybody, and welcome to Optimum Derby. Wherever you're watching us today on YouTube or LinkedIn, you are very welcome. Today, we're going to be discussing an injury which lots of sportsmen and women suffer from, and that is a torn rotator cuff, leading to much bad shoulder pain. And as ever, I'm joined by the man in the know who's going to talk us through that injury and all the vagaries that come off that, and that's Tom Heeley. Hi, Tom. Good afternoon.
You well, Martin?
Yes, thank you. You?
Good, very good, mate. Good.
Let's get into it then. Let's get cracking. Just before we do, though, if you're watching us on YouTube today and you haven't subscribed, please do so. There's loads of information on loads of injuries on there that Tom and I have spoken about over the last few months. So have a look and see if there's anything that can help you in your injury recovery. Tom, let's crack on with the rotator cuff. For starters, just a bit of explanation about what one is and where it is.
So you have 4 rotator cuff muscles. They all originate from your shoulder blade, which is also called your scapula. And you've got 3 on the back side that you can feel, so almost here. Yeah. And then you have 1 that's almost on the underside. If you can imagine between your shoulder blade and your ribs, you have another one there. So all 3 on the back wrap around and attach onto the outer side of your shoulder and your arm. And when they contract, they turn your arm outwards. Okay. So you take your palm from touching your chest out, and then the other one that comes on the inside, when that one contracts, it pulls your arm across your body. Okay. They also get involved in sort of stabilizing in those positions as you move through up and down as well.
Is it worth us looking at the diagrams now, Tom, that you said?
Yeah, I think pull them up. Yeah, for sure. It'd be easy to look at. Yeah. So the picture on the left-hand side is looking, imagine if you've taken the ribs away. So you can see the muscle on the inside called your subscapularis, which runs on the inner side of your shoulder blade, so between your ribs. And then on the right-hand side, so the posterior view, that's looking from the back. So that's your right shoulder looking from the back of it. You've got your supraspinatus up at the top, and then you've got the 2 lower ones, infra and teres minor.
Okay. And then there's this one as well.
Yeah, so this shows a little bit about how the supraspinatus, so if you go back one, Martin, the supraspinatus on the right-hand side, and you can see it finishing on the left-hand side. As that muscle travels across the top of the blade, it then starts to pierce a little hole that sits basically between the blade, the collarbone, and then attaches onto the arm. So you can see on the left-hand side, it attaches onto the top of the arm, that supraspinatus muscle. Well, the next image shows how that gap that just sits above the top of the arm, that gets closed. And that's where you can sometimes end up with something called subacromial space, or the narrowing of the space, or an impingement on the muscle. And you end up with some sort of tethering maybe on the tendon, or an inflamed tendon because it's getting compressed, and the top of the humeral head or the top of the arm is pushing up into that area.
Yeah, okay. So we'll just take these off for the time being. For those people that play sports involving shoulders, man, volleyball, basketball, certainly from my experience, cricketers had a lot of shoulder problems, throwing from the boundary, etc. When do you get to that stage where you start thinking there's something properly wrong here instead of just a pulled or a twinged muscle?
Yeah, so I think commonly sort of the big telltale sign is you get pain lifting your arm sort of between 90 and 120 degrees. So if you're going from your side at 0 and obviously 180 is up at the top, somewhere in that middle ground, you'll get some sort of discomfort. You might get a little click, and that will be painful, you'd expect. But again, you'll struggle with things like throwing, because you have to accelerate and then release and decelerate quickly, or else your arm will just carry on going that way. Yeah. Actually, when you start having to do that very, very quickly, so like throwing in cricket, for example, or throwing a javelin or something bigger, that's when you can start to get those pains and aches. And it's because those muscles are continually getting used and repetitive actions on them, really.
I specifically remember, Tom, when throwing to the boundary in cricket, for example, with rotator cuff injuries, you wind up and you go like that, and you just reach a moment where you think, further, and the ball just sort of goes half the way, and you can't finish the motion, and you're left riding.
So true. It's so true. And that's because you're asking those muscles to do an awful lot of force. Imagine you've literally cocked your arm back. You've probably taken half a step, and
Yeah.
you've gone to throw and let go, you've only really got those three muscles necessarily on the back to kind of hold that in place and to stop the shoulder blades and the rest of the arm just wrapping around. So it's a lot of effort onto three muscles really, and over time that overuse into that area can cause that tethering across the top on that second picture that you showed through that space. So typical telltale sign would be struggling to lift it much beyond here, maybe with some clicking and pain within this region here. Might be comfortable at the top and comfortable at the bottom, and then when you're trying to throw a ball or do anything that's a bit explosive, you'll get some discomfort as well.
And in that diagnosis you just explained there about the arm movement, are we talking sore or painful rotator cuffs, or are we talking actual tears? That's what you just described.
Yeah, so that movement there is something. It's actually a bit of a test. It's called the painful arc, and within that range there, you start to compress the ball in the socket. So if I'm doing an imaginary sort of shoulder blade, and then the top of the blade where the ball sits into this gap here. Yeah. If I start to take my arm through this area here, you can start to compress the tendon.
Okay.
As you go beyond that 90 degrees, the ball will then have to drop. And as the ball then has to drop, you create that space again, and you have the space here. But as you get to that gap there, you compress the tendon down, and that's where you get the pinch and the discomfort. And it actually might not be in the shoulder. You might feel it somewhere down the arm. It might feel sort of like a pencil line that you can draw somewhere down here. Yeah. It might not typically be directly in the shoulder or anywhere near the rotator cuff or the shoulder blade, to be honest.
Okay. Before we get into what to do if you've got this issue, what damage can be done if it's not treated? I mean, it's sort of you would sort of hope you stop using it at a certain stage. Certainly, when I was describing throwing that ball, that's. I mean, if you don't know you need to see somebody at that stage, you need your head banging. But what can be done if it's left untreated?
If it's left untreated, I mean, sort of because of the way it is, and how uncomfortable it is, to throw the ball like that, you'll have one instant like that where it'll be sore. You'll try it again the next week and it'll still be sore. You'll try it again the week after, it'll still be sore.
Yeah.
The thing is, you're not going to be able to keep redoing that action over and over again because it is so uncomfortable that it almost just stops you in your tracks anyway. So in terms of getting a full out tear, there is a risk of that, but the risk is low. The bigger risk is that you end up extremely weak within the arm and the shoulder because you don't want to use it. And then things like frozen shoulder and things like that can start to kick in because you don't want to use the arm, and it leads to compensatory stuff. And then your elbow starts to hurt and you get neck ache, and you just don't want to use the arm anymore, the shoulder specifically. So you try and make other ways around it. So worst case, you could tear one of the rotator cuff muscles completely, but that's unlikely because you're not going to want to use it at all. So the likelihood is probably more likely some sort of frozen shoulder type thing or compensatory patterns that start happening.
Is it an injury that would hurt you if you, I don't know, let's say you've developed it last month of any season, cricket season, and you're struggling with it, a season comes to an end, you're not doing that anymore for a couple of months. Would you still feel it then in your everyday use?
Yeah, there's potential for that. Yeah, there's certainly potential for that, especially with the volume of stuff and how far you're trying to throw the ball on the cricket pitch. Then when you get that off season there, the mechanics are probably still going to be there. So even if you took a month off, then you go back to throwing your ball again. Even people who throw a dog ball in the park, do you know that same sort of action, that same sort of pattern? You might throw it 20, 30 times. It's sore. You go on holiday for 2 weeks. You come back and you throw a ball again. It's still sore. Well, unfortunately, the mechanics that caused the problem in the first place haven't changed. So in that 2 week period, although the tendon's less inflamed and less angry, actually, as soon as you go back to throwing that ball again, you're going to keep on squashing that tendon and give that same pain. So it's a muscular imbalance that needs fixing necessarily.
And for those people that haven't had it before, just describe what the pain's like. How does it feel? Sharp pain?
It'll be there all the time. So like sitting here now, you probably won't really experience it too much. It'll catch you out if you go to do certain things. So funny little things like maybe sat in the driver's seat or sat in the passenger seat, and with your right arm trying to reach behind you in the car, or even do your bra strap up, or reach behind your back and scratch your back. Those sorts of funny little day-to-day movements will catch you out, and you'll probably start to noticing that they're limiting your movement. Also things like putting a jacket on, so you've put the left arm in and then you're trying to swing that right arm in, just becomes uncomfortable and pinches. So they're the sort of a couple of the telltale signs that you would notice on a day-to-day basis as well.
Yeah, it's funny when you say that, because specifically that one where you are driving and trying to reverse into a car parking space.
Yeah,
I put my arm around the passenger seat, look over there, and just watch you do that made me think, yeah, that hurt.
it's exactly that sort of action, and that just puts that big compression and big pinch onto an already inflamed tendon that's going through a relatively small space, and you've now just kind of squashed it right down. So it's going to be sore. You can move out of that position and it'll ache a little bit, but it'll kind of go away quite quickly.
Yeah. Okay, somebody's come to Optimum Derby to see you about theirs. What do you do about it? What do you do, and what do you encourage the client patient to do?
I think the biggest thing, first of all, is listening to what the mechanics are. So what the sport is, so like for yourself, Martin, cricket and boundary throwing. So with boundary throwing, we know that there's a lot of deceleration force that goes on. So you're cocking your arm back, you throw it in, but then at that point, you've got to decelerate quickly to stop your arm continuing on forwards. So that requires an awful lot of force, and that requires force at this angle. Some people do sports that require strength sort of with their arm down by the side or with their arm right over and above the head. So first of all, it's listening to that. And then the biggest thing I would start to look at then is how the shoulder blade interacts with the rib cage and how that moves around the ribs. Because sometimes people will kind of get stiff and locked and be scared to allow the shoulder blade to move. And sometimes it's the opposite, like the shoulder blade is so loose and moving around all over the place. So it's either one of those two, correct those sorts of mechanics, and then do some rotator cuff strengthening work. And during a progressive period of time, that sort of those exercises will start to help. Things will start to come back and return into motion. A lot of posterior chain work, so a lot of like anything sort of through the back of the body. So rowing activities are always useful as well. And again, it's just kind of managing movements and getting some of the movements back that need to return. So just simple things like, even if it's getting something out the top shelf of the fridge, or like you said, doing your bra strap up, that sort of stuff that can be really irritating. If we need to work on that first, then we'll focus on that first, and then kind of focus on the other things that are not so much day to day, but affect your sport or your lifestyle.
Yeah, and hard to judge, because you judge everybody on individual cases. But how long would a rough average recovery be from me coming in having stopped playing cricket because it's in too much pain to being back doing what I want to do?
Sometimes it really doesn't take very long. It might take anything from 6 to 12 weeks. 6 to 12 weeks. And 6 would be that you've probably come to me when it first started hurting. 12 weeks might be a bit further down the line, once it's been going on for a few periods of time. You've given some rest, you've gone back to it, you've given some rest, come back to it, and then it becomes like a bit of a chronic issue. So it generally takes a little bit longer to fix and get on top of. I'm not saying that means you need to do more sessions here. It just necessarily means that it's going to take longer to repair, and we're going to need to do these exercises for a longer period before it has an effect.
Sure. Obviously, I've been talking about cricket today, and you touched on a couple of other sports there. But where do you notice people coming from? Which sports that this injury may be prevalent for?
Tennis is a key one. Again, it's just a lot of like one-sided dominant, and again, sort of overhead sort of activity with the serve as well. Generally speaking, it's when people start something new for the first time. So they've gone straight into playing tennis 3 times a week, or they've gone straight into doing, I'm trying to think now, cricket, for example, throwing a ball, or even get a dog, like I've just said earlier, like something like that all of a sudden you've gone from 0 to nothing very, very quick. 0 to a lot very, very quickly. Yeah. And that's the sort of thing that catches you out, because you're not conditioned, or the muscles aren't conditioned to be able to support that. And it's only after a period of time of throwing that it becomes a nag.
Okay, interesting. Thanks for that, Tom. That's really, really interesting. I hope that's been useful for people. We'll call it a day there. But before we do, Tom, some travelling coming up for you over the next couple of weeks. What can you tell us about where you're off to?
Got a trip to, so we've got the final 2 World Cups of the season with GB Moguls. So we travelled to Kazakhstan, and then back for a few days, and then we travelled to Italy for the finals and the World Juniors, and then go on a honeymoon a few weeks after that. So it'll be lovely.
Nice. And what about Kazakhstan? Have you ever been there before?
No. I'm looking forward to it. I think it'll be I always like sort of seeing different cultures and different what's going on and how different places are and what sort of food they eat.
Yeah.
I really enjoy it. I think it's great. So yeah, looking forward to it from that point of view, and yeah, we'll see what it's like.
And if people need to be seen before you get going or book themselves in for when you get back, just get in touch as normal.
Yeah, 100%. Yeah, get in touch as normal. Book online. I'll be on email, so even just drop me an email. That'll work fine.
Okay, lovely. Thanks for that, Tom. Much appreciated. No doubt we'll catch up with you at some stage over the near future with regards to that. In the meantime, folks, thanks for joining us today. If you want to find out more about Optimum Derby, please check out the website. There's all sorts of information on there about Optimum can do and how they can help you not only through your injuries, but rehab against future injury. As I said at the start, if you've not already subscribed to our YouTube channel, please do so. There's all sorts of videos on there that can help you through a variety of injuries, anything from concussions to sciatica to plantar fasciitis, and specifically related to today's episode, shoulder press injuries. If you go to the gym and use shoulder presses a lot, there's one on there for that. So please go and check that out. And if you need to email Tom about anything, his email address is on the bottom of the page now. So please get in touch with him. He'll be happy to answer any questions you've got, not only from today's episode, but for any other injuries you may be suffering from or be looking to book into the clinic. That is me, Martin Crowson. Say thanks once again for joining us today, whether you've watched us on YouTube or LinkedIn. We'll be back on Optimum Derby Live very soon. Until then, all the best from both of us. Goodbye.